Ciao mondo, hello world, hola mundo, hello monde. Here we are with another cappuccino, and we have some interesting results about the effect of extracorporeal therapies on septic patients. In particular, some years ago we had proposed the peak concentration hypothesis, where we demonstrated the presence of pro-inflammatory mediators and anti-inflammatory mediators in subsequent waves or even simultaneously in septic patient and patient with septic shock. And we proposed the possibility that extracorporeal therapies may actually cut the peak of concentration of both pro and anti-inflammatory mediators, somehow achieving a kind of immuno homeostasis. Now, some results recently using sorbents, for example, the Cytosorb cartridge, but also the Polymixin B coated cartridge for absorption of endotoxin and different mediators, have shown the possibility of reducing the burden of inflammation and anti-inflammation in septic patients. In particular, the interesting aspect is that based on the report of Hotchkiss that showed patient dying very soon for hyperinflammation or patient dying later on for immunodepression, the possibility of proposing a therapy that somehow, in spite of our inadequacy and not capability to diagnose in which state the patient is in that specific moment, we might actually provide a reconstitution of the immune response. I think that this concept of immunomodulation of extracorporeal therapies is extremely important because it may allow us to gain time for patients to move forward in the ICU stay, and possibly to have antibiotics making a good impact, or other therapies affecting mortality and complication in these patients. So our studies and other group studies are today oriented towards the concept of immunomodulation. And one specific thing I would like to point out is the improvement in HLA-DR expression after the use of hemoperfusion with cytosorbents and Polymixin B sorbents. The so-called immunomodulation may be achieved when HLA-DR expression, which is the capacity of the organism to present the antigen and therefore somehow represents a restoration of the capacity of the immune system. I think that this increase after the treatment shows that probably the patient has changed the condition of immunodysregulation typical of sepsis. Today, the definition of sepsis is clearly stating that there is an inappropriate immune response after invasion of bacterial and different agents in the body. I think that therefore the improvement in HLA-DR expression and the immunomodulation achieved in this patient by extracorporeal therapy may be the target to study in the future months with this new therapy. Given this suggestion, I would like to thank you for following today Cappuccino in Vicenza, and we will have more to come in the next months because the results of our pilot study will be presented very soon. Thank you very much and have a wonderful day. Excellent.